of the civic tech community. Been to my share of hackathons. Used to be the product manager for the Open Data Catalog way back when. So it's great to see a lot of familiar faces and a whole bunch of new ones. I always consider this community and the type of work that you have advocated for and participated in when we design our products in the Ontario government, because I recognize that you are part of a broader community and a valuable part of it. So today I just wanted to, chat with you a bit about the work we've been doing on our COVID self-assessment finder, our assessment pages, which are new too. So I'll share a bit about what that looks like as well. But also we have a couple folks from our product team here as well. David DeMedicis, who's our content designer, I think is on the line, might be making dinner throughout this. And we have Bain, our lead developer, who's helped get a lot of the stuff out and into the community. And hopefully they can stick around if they are able to answer a few questions that I'm sure they do a better job at than I am. Okay, so I'm gonna share my screen now, walk through a few slides and just kind of chat about what makes doing product different during a pandemic, because this is not, just another day at the office, that's for sure. So looking back now, a few months, I guess, a couple months, which feels like both the longest 2 months, 2.5 months that I've had, and maybe my entire life. And also, I can't believe it's just been a few months. It feels like a lifetime. But if we kind of can think back to that, second week of March, when it was kind of becoming clear that, the world was never going to be the same again, that we were staring down in an epochal moment and what that was going to mean for everyone. And, for me and, folks I work with, a lot of us, the work we were doing perhaps on other products became either non-viable. For instance, I was working on digital disability determination. So looking to, at the time, interview and do user research with a whole bunch of public health and healthcare professionals who immediately wouldn't have that time available. And it was clear, that weekend that with things never going back to normal again, the abilities of the Ontario Digital Service where I work were going to be in high demand, and the ability to stand up a good product in a short amount of time was going to become something that the rest of government would be looking to us to help with. So as that was going down, a few of our product team were chatting. I was chatting with my boss around, what this is going to look like. And, that I'd be able to swap in and help, lead a team that would, deliver something. We didn't know what. So that Monday, which is, I can't remember what Monday is, but like that second week of March, that Monday, we all kind of showed up, got on some calls. We worked with an area in the government called the Health Services INIT cluster that kind of runs a lot of these solutions and works with Ontario Health, formerly eHealth, and those folks to stand up, more integrated IT solutions. So we all got on a call. We're like, what do we need to do? Like, how do we start this work? What needs to be done? And two pieces of work that were immediately identified was a lab results checker that people would need to get COVID test results. And also that folks, didn't really know what to do around if they had symptoms that could be COVID-19, if they might be at risk for other reasons. No one really knew what was going on and what COVID-19 meant for them. So there was a tremendous amount of anxiety. You make split-second decisions in those moments. And, we immediately kind of hopped on Google Trends and saw coronavirus was, in Canada was sort of declining a little bit, and COVID-19 was rising up. And we knew we're going to need to stand up some type of application. And in government, you need, you can't just do that. You can't just put out an application. You need approved domain names. You need DNS zones cleared. You make sure you're following sort of, typical processes. And, these processes can take months, to get a website up and going. And, I've had my share of experiences across the web community in the Ontario government. So I kind of knew the people to call to get this moving. And we made a quick call. We said we need a subdomain at covid19.ontario.ca. Had that up towards the end of the day. Had a staging environment up. And we only were then deciding that it's like, okay, we're going to do this self-assessment tool. This is a good thing for the Ontario Digital Service to do. It had a lot of focus on usability and content. And it was something that wasn't going to be wildly intense initially from an IT integration perspective. So it was a good fit for us. And it was right around that time we were started chatting with, folks in Alberta, and, they had a tool up. And, we had web content at the time. There was just a web page that said, here's what you do if you, have symptoms. But it was really, really good content in the sense that it was there, but it was not really finessed in a way that would make sense from a user's perspective to try to navigate their own individual concerns around COVID-19. So what happened, right? We got on the horn with Alberta. We started chatting with them. I'm going to show you that we saw this tool here, this Alberta Services tool, and we chatted with them and said, hey, can you share your code? They said, yeah, for sure. We can definitely do that. It's a single page app. Yeah, we can send it over to you. And it was funny. One of the first blockers, I think that first day, and Bane and I were like, where's the code? Why aren't we getting it? The first blocker was our own Microsoft Outlook and our email security smackdown and attachment coming from outside the government because they assumed it was nefarious. So we're running around trying to figure out where this code is, and then eventually I have to throw it up on Google Drive somewhere. Lost a few hours. But when you're doing this type of work, there's a quick sort of way to kind of jump into it, but also you want to be conscious of what you're trying to do. So what was driving us, right? That very first day, well, we knew we needed a self-assessment tool to solve things, but what are we going to solve? So what we wanted to look at was, okay, the number one user need here, and his user story, is to communicate targeted public health advice around COVID-19. The Ministry of Health needs to get that word out and tell people what to do. We also need to relieve pressure on phone and in-person channels because people were just hitting telehealth all day. And it was, hours and hours, 8 hours at some point, just, a real intense time for them. And also there was this pressure to get more data around COVID-19 because we didn't know where it was going on. We didn't have a lot of surveillance out there. We didn't know. There was so much we didn't know. So we needed to gather data to make better decisions. So that's what we would call like a syndromic surveillance piece, the relief piece, and the public health advice piece. So those are interesting dynamics we're going to come back to a little bit later. So within like a few days, we had the basis of this tool up. We had a team come together. We had a lead developer, brought in a front end. We brought in a designer who's got a lot of great experience with sort of the medical side of things. And we're working at the time with a cabinet office to work through content. So like in a matter of a few days, this site was up and, got approved and it was out and people were using it. So, where app development, even a simple app like this can take months and months to get up with approvals and everything. We were able to stand this thing up in, I think, 4 days, and it was out, and it was so clear that it was meeting a user need right away that it really showed that, the tenacity that it took to get this thing out. I'm not saying it was easy. There was a lot of, I think we were all working extremely late nights. We were struggling through our own anxieties around this thing. And, it's an important time for government to have collapsed some of its silos. So we were getting this advice from the Chief Medical Officer of Ontario, and his team, specifically his Director of Emergency Preparedness, was my primary contact for this. And we're trying to sort through a whole bunch of web content and a whole bunch of like Word documents and try to understand what's going on. And, at the time, I was anxious. I was suffering from some sort of man cold, and I was like kind of coughing, and I had these weird slight chest pain, and I was like, I don't know what's going on here. I feel a little weird. I'm kind of feel like a user here. We don't always have the benefit of being a user of our own products, but in this case, I felt like, my anxieties are, probably worth running through this thing. And I was talking to this, director. I was like, well, I was reading through the advice, and, what you're saying to me is that, if people have, mild symptoms like I do, that they just need to practice at the time what we were calling social distancing. And he said, yeah, that's right, social distancing. Okay, cool. And he's like, okay, then we're gonna do this. I'm like, but wait, let me just rewind here. As a public health official, would you tell someone like me who's got a new cough, a bit of tightness in his chest, just to continue walking around like normal outside and going about my business, other than maybe keeping a little bit further away from people? And he's like, no, absolutely not. You should self-isolate for 14 days until these symptoms are gone. Like, that's concerning. And I was like, well, yeah, but that's not what your papers say. So there's this bit of a disconnect between announcing something in a press conference and getting it into the web in a way that makes sense for people, people to read through it. And we were able to have those quick conversations with them and have a direct line that normally would be brokered by, a lot of, bureaucratic channels, ministers' offices, communications offices, things like that. But that one-to-one allowed this thing to get up and have some integrity right away. We were able to do some quick design work, as you've seen with the Ontario Design System, some language work, break it out into actual web content. I'll chat a bit more about the content piece later, but it was, getting out what we would call an MVP, which is still important when you're designing under pandemic pressure. is still, something to keep your eye on. It's to get out something that's going to help a lot of people. Might not help everyone. It might not be perfect, but the fact that it needed to get out was something that drove us all. But still, even under all this pressure and all this understanding that this is vital for government, we had this thing done, and a lot of people had seen it all the way up to the Premier's office, cabinet office, and the cabinet table. And then we're trying to get this thing out Thursday night, and everyone kind of forgot. They're like, oh yeah, we didn't actually approve this. It got stuck in approvals for one day. And it was only when I was like on the phone, we have a pretty flat org at the ODS with our assistant deputy minister. And I was like, you realize that the content on the web is a week old now. Like in the time, regular days, weeks, nothing. In that first week of COVID-19, a week was an eternity. We had stale content up, and no one in a senior position really realized it, right? Because they were looking at the web. They were focused on any number of emergency priorities. So it took that sort of senior voice to be like, we need to get this out now. I think we can't wait for every approval in the world to land. We need to push this out and publish it and redirect those pages. And we did what was called a bit of a soft launch. So before all the communications and marketing went out, we just replaced the web page with this up-to-date content. And that's what we put out. This is the first iteration of the self-assessment tool. In the first week, it immediately got a lot of hype on the internet. People in Ontario were flocking to it. Tons of retweets. John McGrath from TVO noticed that we had a little shout out to Alberta Health Services, and he says in his tweet here, the Federation is working, which is nice, right? Because it shows that keeping things open is vital, right? And sharing things across Canada, where all have a shared fight against COVID-19, and this was a great example of it. This thing went out, and it was really clear in that first week that people really wanted this content. There were so many people with anxiety. There were so many conflicting pieces of advice that differ from province to province and state to state. What are the symptoms to look for? What should I do if I'm at risk? When should I stay home? When should I not stay home? There was just like, people were freaked out, and with good reason, right? It's a scary time. So we spun up a data view to understand where this, what people were seeing. You can see here, this is a snapshot from that first week on, I guess, April 14th. First few weeks there, 1.1 million views by that point. And then you can see throughout that first period, there was a real sort of like desire for this stuff. And we were tracking what people were landing on. So you could see, that a certain amount of people were told to physically distance. Some were told to self-isolate because they had some symptoms. Folks were at risk. People were returning from travel. And we were using that to kind of understand with GA, like, where are the COVID hotspots? Where should be targeted with marketing? What should we be doing with, that type of stuff? So that first week, we got it all out. And then, a week or two later, our subsite went up in that domain that we had day one knew we were going to need. And then we started to put some of our other applications within that domain. And then that first weekend, that Sunday, I think, Bain got up our code up onto GitHub. So that was our sort of like making things open, make things better. We know this. We believe in the open source community. Bain got this thing up. And wouldn't you know it, all of a sudden, like a week later, all of this shit shows up. This is like I think like a bit of a business support group for folks who are running small businesses. It's an organization that helps them navigate bureaucratic processes and stuff. But also in this case, they wanted to see help businesses figure out if they could get any financial help while they were struggling during COVID and figuring out whether or not their business was viable. I never would have thought in a million years that this would be where the code would go. Bain mentioned to me, our developer, that Shoppers Drug Mart, somebody knows there was adapting the code to be part of an IVR, so you would press buttons while you're on hold to see what your optimum balance is or something. All that is because we made this thing open and got that out within that first week, and really hit like a sort of need for people to repurpose things and move quickly, just like we did, right? We paid it forward so the open source community could benefit. Let's see if there's any questions just before we move on. So yeah, David's got he's our content guy, so you can answer some questions near the end there. Okay, so moving along here, let's get back into it. Even though we're under this pressure, right, and this thing's iterating all the time, the need for user testing is still so central to what we do in the ODS and in product development. We know that stakeholder feedback can't replace structured user testing that reflects, our diverse personas. And with complex and shifting medical advice, user-centered design and plain language content. I mean, it's just more vital than ever. So David has dropped off, but he's been at the heart of this work, where we have taken user testing. We've listened to people say that I don't understand what that language means. One of the first questions we had in the self-assessment tool when you first used it was, are you experiencing, like chest tightness, extreme fatigue? So saying, more tired than usual. And then one of the lines there was, bullets was trouble waking up. And we talked to some users, we're like, yeah, I'm having trouble waking up. The world's ending. I'm depressed. I lost my job. I sure as heck don't want to get out of bed. And yeah, it didn't work for people who were under mental health distress, which a lot of people were. And we were able to take that out and go back to the chief medical officer's team and say, okay, we need to account for that sort of stuff in our content, right? So I think you'll see here, like, iterating something is vital when you're doing this type of work. To go from a web page to a application, a one-page application, through to something that really gives people what they want. People who turned out in user testing, they didn't want the government to play diagnoser and say, it is unlikely you have COVID-19, because an app shouldn't be doing that. What they wanted to do is to give you clear direction. Say, you must stay home for 14 days after your symptoms began, or you go get tested, or because you're at risk, you shouldn't go outside of your house except for medical appointments. Get people to bring you groceries, like really specific, targeted advice. And all of that was informed by user testing. And it was just, we've done probably 50 user tests since we started this thing, and we learned something new every single time. So it's important to follow your service standard, like we have in the OPS, the digital service standard, even and especially when pressure is on, and that it's a vital app. So we still had time for accessibility. We still remediated it. We still tested with people who need to use assistive devices. Folks with low division. We worked with the CNIB to iron out some other minor issues that they noticed, and we just kept building and iterating on this thing. Several releases a week. And it also, it's important to note that this isn't product development as usual, in the sense that you're doing tons of research up front, really well organized Jira boards, sprints, tickets, all that stuff. It was sort of like, everybody jump in a Slack thread, let's start dishing this out. But it's a testament to how we work in the ODS and how experienced a team we have to spin this up, that I'm able to get designers I know work well with each other, that I work well with a super talented lead developer who can do something like this quickly. And we can work remotely, and we are uniquely empowered to make this happen. So it's not just like, surprise, here's this thing, we just pulled it out of a hat. It's because we're spending, a long time learning to work like this and practicing. And, we have a strong sense of team and what it takes to stand up a product like this. And we know how, we know about the various communities that are around to support it. Also recognizing that people are going to use this on their phone more than anything. So our mobile rate is like 60 or 70% of people actually do this on a mobile device. So we have to design mobile first. We have to adjust content for people who are using mobile devices, who might be sick, who might not be able to read long-winded medical jargon and need to get clear, concise web content that they can digest. If you're sick, it's different than if you are sitting down and doing, consultation on an environmental issue. We have to recognize that with people. But nevertheless, there was a desire for more, and to take what was a simple one-page application at the time, even though we were iterating the content and it was changing, and we moved it from that single-page app that we got from Alberta Health Services, and we moved it to React, and Bain was basically rebuilding everything under the hood into something quite a bit more complex and sustainable. But that was happening in lockstep with the usability. So the tech is evolving. We're moving from Amazon Web Services in basically a flat file in an S3 bucket to Ontario's Go Cloud service, which is an Azure cloud thing. And so all these things are happening, but it's not jarring for the user because that sort of usability is maintained. But we're also working with an organization called Ontario Health, or eHealth, around integrating this thing with a whole bunch of other technologies. So look at this architecture. Maybe don't look at this architecture, but the point is, this stuff is complex, and the user need from their perspective was, well, we need to supply people who are going to be self-isolating at home, who aren't able to get a COVID test yet because we don't have the capacity, that are relatively healthy, but we need to understand the difference between a probable COVID case and someone who might just be sick otherwise. And if they are sick, we want to follow up with them. So they spun up this, this project plan with using Salesforce and a whole bunch of medical students who are going to finish their year early, who would be able to call you back if you have, symptoms and you've opted in for a callback. So if you see this complexity, right, and you imagine what it takes to spin that up and integrate something and bring things over, and now you start not even just dealing with generic anonymous information, you're dealing with personal health information, which is like the most sacred of all information that we have. I heard this funny story from a cybersecurity guy who was part of tagging along with the one of the servers that had all of our health card data at some point. And because it's so high sensitivity, you can't just back it up anywhere. And for a while, the only way the server would turn on is that you had to have a particular pencil, and you'd have to slowly turn the fan on when it rebooted, or else we would lose all this information. And the server and the pencil were making their way from Thunder Bay to our Guelph data center, passed from convoy to convoy to convoy, just because our governance around personal health information is so stringent that you can't just, throw it up in the cloud and send it over somewhere. So that should tell you that the privacy concerns are enormous. The threat risk concerns are enormous, and immediately you're building in so much complexity. So I'm just going to pause for a second. I want to show you sort of where things are at in the app now, do a brief, just like a little brief show and tell as part of this. So here's our site right now. I'm going to take you through a self-assessment. I'll take you through a couple really quick versions of it. So I take this assessment today, and, let's say, I don't have immediate chest pain. There's nothing about waking up funny now. It just says I'm confused or I'm unsure where I am. Clear signs that you're under distress. You see here these symptoms that have evolved a lot. So things like being very careful that what the kind of cough it is, or that your runny nose that you've got right now is not related to seasonal allergies, that it might be something else. And that, we're not calling pink eye conjunctivitis because no one knows what the heck that means. But, now we're saying, okay, well, you have these symptoms. But in this case, I'm going to say I have none. But that I am at risk. I have asthma. Maybe I shouldn't be leaving the house. So now what we've built here, you can sign up for a follow-up call. Stay home, monitor your health. I don't have any symptoms, so I don't have to go get a test. They're saying even though you can get a test if you're asymptomatic, we're trying to make sure that the tests right now are quietly kept for people who really need it. So here is where the rubber hits the road technically. This thing here, this is where you would put in your name and you do all this stuff, opt in, and then you would click submit, and it would send over through this wonderful architecture, get routed up to Salesforce, APIs going this way and that way, JSON objects flying everywhere, all this complexity. And just make this go back to my present mode. And, we had all this logic. Look at this logic. Look how complex this is, right? It was like a choose your own adventure novel of pathways that you could route through the self-assessment tool. And it took months of, a good month of integration work and all this testing to get there and say, okay, we have this new version of the tool ready to go. We soft launched it. We were getting ready for a news release. All these med students are standing by. We've done weeks of end-to-end testing. It's been pen tested, architecture review, privacy review. And then the Premier's office said, you know what? Anyone with any symptoms whatsoever, forget who you are. The slightest symptom, that's enough for you to call telehealth to get an assessment. So in 1 second, all of this became this. So what does that say about complexity? And what does that also say if I show you, where our Google Analytics have been since we've launched this thing? It's still a very busy tool, don't get me wrong. We just had our 3 millionth visitor this week. So it's wildly popular, even by, COVID product standards. But take a look at this. What does this tell you about when the need for this was at its absolute highest? When people were freaking out and didn't know what COVID-19 meant or meant to them, or they still had colds that weren't COVID-19 or flus that weren't COVID-19, or jobs that they might have had to go to still because they weren't working from home yet. And it shows you the diminishing returns in terms of user activity there. And my question, and the problem that in some places we have to ask ourselves in government is that complexity sustainable when you're working in a pandemic? Can you afford complex technical integrations that require end-to-end testing and stringent governance for the slightest change? Because we're an agile team, but Ontario Health is, they admit their waterfall. they think in months and years, not days and hours like we do. So there's a bit of a tension there and a friction about doing this type of work in two very different ways. So yeah, that becomes this. And here we are in Dundas Square, where things are extremely quiet in that first week, and getting that tool out and getting this information to people was just so vital. And you can't really wait to do business as usual at that time. So I want to recognize the folks here that, business isn't the same as what it was. Remote first, it's become remote only. It's hard in some ways. I have a couple young kids. It's not easy to work full time with my partner and I at home all the time. But our teams need to find ways to work, to choose the tools that work for them, to find that new life balance and build in sustainability. And everyone needs to recognize that this is a struggle. Every day we are struggling to do this work and to find our balances. And, it's hard when you have to put your out of office on just because it's a Saturday and you need some time with your family. But that's there's a lot of public servants that are working 70 hours a week, and it is very hard to keep it together. And it's also hard to keep it together when things change all the time. So, you saw that tool and how it's evolved. Well, we spent all that time with that form, right? So let's go back through this fun thing again. Let me tell you what it would be for a regular experience as of today. So let's just start it again really quickly. Going through. Okay. No, I'm good. But you know what? I got a weird loss of sense of taste and smell now. What happens? Oh, okay. Now I can maybe get a COVID test. So now all of a sudden we need to find out where an assessment center is. So last Saturday, I got a call late at night on Saturday. I'm hanging out with my family thing. The Premier's office is announcing that anyone can get a COVID test now. And it doesn't matter about symptoms necessarily, but anyone with any symptoms, with any age, can just show up and, they can get a COVID test now. P.S. We don't have a list of assessment centers other than the spreadsheet that Ontario Health managed for telehealth. What do we do? So what we do is we look at what is a big piece of messy Excel sheet with very folksy information all over it, like, addresses all in one and with postal codes and street addresses and other information all in single cells, folksy notes about what time, Doris is going to show up at Pickle Lake to open the doors to their testing center, completely unstructured in a traditional sense, and no path to getting that done. And it's Saturday and the Premier is announcing something the next day. So what you do is you desperately cobble together a structured piece of data, a CSV, get it so it can be ingested by your product lead, your lead developer, and turn what was going to be for a few hours there when everyone in the cabinet office was really concerned about getting something out, anything out, even if it wasn't accessible, even if it wasn't really usable, it was about getting something out. And we said, no, give us a few hours and we're going to do this. So this is still fresh, still a work in progress. That list, and we built structured data with it. And we've now added the ability to find a center near you with your location data. So now I know I'm 3 kilometers away from St. Joe's. I can quickly go there. A few days later, we added the ability to, drop that into Google Maps, quickly get directions if I'm in my car or, taking a cab down there or something, and see where that assessment center is. We have more stuff to come here. We're still working through this. We're going to add, more of a search. You can put in the first few letters of your postal code, all that good stuff. We're working with Ontario Health to make that data better. But again, right, it's about recognizing who else can benefit from that data. In this case, we have our open data catalog, right? And I wonder if I can search for it. I have to dig it up. So within a week, again, after putting this online, we got the data up. So now this is all open data. And then again, you probably know a lot of folks with experience doing this type of work. This can take weeks, months, sometimes 6 months before any of this data gets structured, gets approved, and gets released. And we had it up, I think, a few days later after we had built that tool. So within a week, we went from what is this messy Excel sheet? Are we putting out a PDF to a list of assessment centers updated every single day on the open data catalog. And that's it. Like, that's what it's all about. It's about recognizing that, you might have, want to represent the interests of, your stakeholders, but you also need to recognize that there's a community of people out there that you need to listen to. You need to be getting feedback from them. We need to iterate things. So even this week, we're adding things to the self-assessment tool. So, we're looking at the data still. I want to show you one last thing. This is something I just discovered today. Check this out. more, this is like all the symptoms. So you can see that, some symptoms are more popular than others. You might get like a sore throat, still pretty high, but no symptoms, which is this blue line here, has been shooting up. And some of our feedback's telling us that's because more and more people are using the self-assessment tool as a way to vet for their, their communities. So people in community gardens need to show that, okay, they're not at risk. They don't have any, issues with COVID-19 or symptoms. And they run through the tool and they're saying, I really need proof of this so I can go get my stuff from my high school, because they're asking me, or my doctor's office is asking me to complete the self-assessment tool before I can go in the building to get my running shoes. So that user needs changing a bit. It's less like, I'm anxious, tell me to stay home, to, okay, I need to give folks a copy of this. So we're building in a simple PDF export that's going to put the date and time and when this was created, so people have a bit of a takeaway they can use going forward. And the self-assessment tool is changing all the time. It needs to change with user needs. It can't be static. And we're going to be collecting those first 3 digits of a postal code for syndromic surveillance soon. And when people want to use the assessment finder, their first 3 digits of their postal code will be, in the tool, and they'll be able to, jump right into it and see what centers are close to them based on the same information that they provided while using the self-assessment tool, and recognizing that it's, all part of an end-to-end journey, and that we need to be considerate of, a continuous experience. Anyway, I've rambled enough. I'm happy to take questions if Bain and David are around. I think it says Bain maybe. I'm sure they're happy to jump in. So I'll stop sharing and open it up to our folks that are graciously listening to me.
That was amazing. Virtual applause, folks. That was awesome. Thank you so much. Okay. So many questions. I'm going to push it onto the floor. Any questions from our attendees, participants? Peter, go ahead.
Spencer. Well, very impressive. I have a lot of questions, but I don't want to ask because I don't want the answer. I mentioned this, mentioned that. So it's a lot of things to be digested. But anyway, so is your app part of the Ministry of Health?
Good question. Kinda.
Kind of.
It's a weird.
But it's not the app for Ontario.
So it is the app for Ontario. It's Ontario's COVID-19 self-assessment tool, specifically for provincial health advice, right? That can differ. It can be a little different in municipalities or public health units. Sometimes they might have specific things like, okay, these are the criteria for this assessment center. It's a murky territory there. The Ministry of Health is our client, though I hate that way of referring to partners and collaborators. But we had a really close relationship with the Chief Medical Officer of Ontario and his team in the Ministry of Health. They're the ones who are defining the public health advice. And they are like, a pandemic is an agile thing. You get new information every day, you need to adjust. And we have a simpatico, have this union where we get it, where it's like, okay, we're hearing now from people that there's concern about COPD, and that should be included as something in the cough symptoms, so people aren't saying they have a cough when it's a chronic condition. And we heard from people online that they're really worried about this sense of taste and smell thing. Is that true? And then we got a doctor on the phone who's like, yeah, that is true. Put that in there. So it's like it's happening pretty quickly with them. But in the sense that the Ministry of Health is the ministry responsible for the COVID-19 response, yes, it is their product, but we are the delivery shop and the product shop that works with them to design it together.
Okay, so I've got a couple more questions. So once this pandemic happened,
yeah,
you people kick in and start from scratch.
We took Alberta's code and then quickly spun that up in a few days to get it online. And with our own content, we plugged in our content, used their basic code structure. And then since then, we've completely rebuilt and changed ours, released different versions. It's very different now technically. Alberta kicked us off, and you could see that the need was there. And if we didn't get that code right away, we might not be able to get it out as quickly as we did, even if it was a couple days longer. Normally a couple days doesn't matter, but I think a couple days in that first week of COVID-19 mattered a lot. And now what we built is amazing. It's way better technically. Bain's built this incredible solution. We kind of joke that it's like a Ferrari engine underneath the hood of a Pinto, but it's pretty great tech wise. Yeah.
Peter, we're gonna pass. Can we pass it around, Peter? Okay.
So over these few months, obviously it goes up on a V curve, you know.
Yeah.
So at this stage, would you classify this as 80% of what you envision as a final all-inclusive app?
Good question. I have no idea what next week's going to bring. I have no idea. It's changed so much, and you can see by how it goes from wildly complex logic to simple logic. There may be a renewed complexity again. I wouldn't be surprised to see the self-assessment tool pivot and become used as a pre-screening tool, because we've got all that infrastructure where if you need a COVID test, you use this tool, put in your information, add in where your details, and it gets sent along to an assessment center that you might even be able to get an appointment at. There's a lot of potential linkages there, and we've got a lot of the foundations for that. So maybe that complicated IT infrastructure that I was kind of lamenting the complexity might be useful in the future, because we've done that hard work to build it. A couple other questions here I'm seeing.
Thanks, Peter.
Navati here saying, how did you manage to structure the test center data in such a short period of time? It's a good question. I looked at the data and I was like, okay, well, obviously we're gonna need to separate postal code from street address. We're obviously gonna need to break out, these pieces from each other. We're gonna need to add a column for whether or not it has drive-through, whether or not it's takes appointments or not, whether or not it's, we're adding columns around French language services and accessibility and, temporary closures. This data is changing every day. And, it's also important to remember that when you're structuring data, we look at data as a bit, apolitical, but the way it's expressed can be, and recognizing, the theme we were talking about a bit about inclusion and, marginalization of people. We put up test centers that were just given to us that, exist. One existed on Six Nations. Another one existed in Ottawa that was, run by an Inuit health center. And then they started to have a bunch of settlers show up and be like, test me for COVID. The premier said I can get a test on Six Nations, which is a blockaded territory, unceded territory that has been, had a lot of its sort of, its traditional rights sort of reasserted lately. So having someone show up and demand to be tested on the Six Nations just because they saw something on a website that you built, that has some gravity and some implications, and we need to be mindful of that, right? So we were able to pull that down pretty quick until we sorted it out. But that's the kind of feedback loop you need to have, because your seemingly innocuous web content and open data could result in a pretty serious issues of indigenous sovereignty. It's wild how it can go from someone not getting it, or people showing up and it's just, they need to get a test and it's not open. So structuring that data, and also French is so painful when it comes to CSVs. So you can imagine that when we sent it off to a translator and it came back because of Mac versus PC versus UTF-8 encoding issues, and accents were backwards, columns were readjusted. That was a big delay even that one day, just because we had to put Humpty Dumpty back together again. And now we're going to work with Ontario Health to get good APIs, send it off to a few places. But it was structuring the data, getting that MVP out, doing a bit of painful manual work to ingest it on our side, and just have people willing to do the painful manual work of looking up longitude and latitude, managing a couple of spreadsheets. At the end of the day, sometimes you need to just do the work. And that's what happened that weekend. We had one senior person in the chief medical officer's area, a consultant who does public health advice, actually grinding out CSVs with us. So you just got to do it sometimes. Structure it and do it. What other questions have we got here?
We went from Mayuki.
Let's see.
Mayuki, do you want to ask your question?
I typed my question at the bottom, so whenever he gets there, that's fine.
Okay.
How you managed to get users to test on during a pandemic? Well, I mean, we've done a lot of user testing in the past over, using Zoom when I was rebuilding the environmental registry. So that business is usual for us. And what was really interesting, we put out a big call on Twitter with our experienced design team. Hundreds of people were happy to help, even though there was an honorarium. I don't think that mattered. People really wanted to help. And when you ask them about, doing this type of thing, and providing things like, are you comfortable with sharing, say, like your postal code, the first 3 digits, and your symptoms, and even for a callback, are you comfortable? They said, yeah, because I know how important it is to give the government data to respond to this stuff. So it was interesting. It was really interesting to see like there was a real sense of like camaraderie amongst people that they know that we all have to work together to kind of get through this. And our user testing almost universally validated that people were willing to give a little bit more than they might have otherwise. And when you read our feedback, we get a lot of feedback in every day, overwhelming support for this thing. I didn't expect it to be so positive. People seeing how easy it is and how quick it is and how it's clearly responding to changing the changing narrative. It's become a little less prescriptive and saying, do not leave your house, whatever you do, to, okay, if you're going to go out, maybe now you should wear a mask because that's changed. And keep your distance, avoid large crowds, outside's better than inside, yada, yada, yada. And it's just because COVID-19 is changing every single day, your content and your product needs to change almost every single day as well. Any other questions? Anything we can help to contribute? I mean, if the calls for user testing open up again, for sure. But there's always people who use stuff like this. Look at open data. If you see a need for things that we're missing, by all means, shout it out. Like we had someone on in Git, I think, gave us feedback in the first week around the tool saying, you're really not accounting for community spread here, because there was a real emphasis on travel at the time, returning from travel and being exposed to someone who returned from travel. And they're like, well, we're pretty sure it's spreading in the community. How come you're not acknowledging it? So we kind of took that and we adjusted the way the content was positioned to, be a little more respectful that was probably happening. Which seems strange now because it's so obvious that community spread is everywhere. But those first few weeks, that wasn't quite the mainstream narrative, at least in government yet.
Are we doing any sort of surveys together and user feedback of the assessment tool?
End user feedback. So our primary way of getting feedback is right now through structured user tests, as well as through the quantitative data through GA, what events people are hitting, where they're going with it, where the bounce rates are, but also that feedback form, right? That's how we were hearing about that. People want to PDF this thing, that just having a web page isn't necessarily the most useful thing when people need to take it away with them. So the feedback form has been really vital. People saying, hey, I have COPD. I probably shouldn't click that I have a cough, but you didn't really account for me either. So that stuff helps. That matters. People read the feedback. My favorite piece of feedback was an 8-year-old boy said, I'm 8 years old. I have a migraine. I took your self-assessment test and now I feel better that it's not COVID, but also my wrist hurts, RIST. But I said to David, our content designer, I said, David, your content is so easy to understand. An 8-year-old with a migraine can get through it. It's pretty good. It's pretty high praise. And that's it's a good benchmark, right? Because people need to read this stuff when they're sick, and when we have to be inclusive to people who don't speak English as their first language necessarily, who are those people who are most at risk of COVID are also least likely to speak English as their first language. And when we were writing this thing, we always had that lens on inclusion and mindful of people who are at risk. So a good example of that, about data not being agnostic to, or it should be agnostic to people, is that if you look at how we collected data around healthcare professionals and who has COVID-19, something like 2,000, this is not an accurate number, but it's something like that, 2,000 healthcare professionals have come down with COVID-19. Like 50 doctors, a couple hundred nurses, and then a category called other. An other can include, it can include lab technicians and personal support workers and hospital administrative staff. But it's kind of like, well, what do you think most of those people are? Who are the people that are actually changing, people's diapers in long-term care homes, or holding people's hands, are bathing them? It's personal support workers, and they have the least amount of PPE. They're the most likely to be from marginalized communities and to live in multi-generational families or rooming houses, and they're extremely vulnerable. And I don't think the doctor is going to have a problem getting a COVID-19 test or know what they need to do. But I'll tell you, that personal support worker who goes into apartments to service the elderly sure as hell might need to know in very plain language what the heck it is they need to do if they have a new symptom, or if they were exposed to someone with COVID-19 without PPE. So we really want to put those people at the absolute center of our work and recognize that, you know, you need to design for them first and foremost. And the established professionals are probably not going to be the ones who need your tool the most.
So much engagement tonight. I'm mindful that it's like 8:15, but are you like, can we take like one or two more questions?
Sure.
Is that cool, Stens? And
Yeah,
folks,
for sure.
just because like, there's so many people still online. This is amazing. So Mayuki, I love your question. You know, it's inspiring. Really wish more people for the nonprofit sector were here. Totally agree. Just wondering how you managed to get users to test on during a pandemic. That's a great question.
Yeah, Twitter. Put out a tweet with a survey and people jumped on it. It was that easy. I amplified it and then screened it, right? So we got so many responses. We're like, we need people from the GTA. We need people, you know, who are diverse, people who have different work settings. We had patient advocates, but also completely random people. We had people taking user testing with kids screaming in the background, which is actually great because that simulates how you're going to do this thing. And, you know, by getting a huge pool of people, we were able to find just the right group of people to test. And our next phase is going to be testing people end to end. Say, you're worried you have COVID-19, what do you do? So maybe you use the self-assessment tool, maybe you go right to the assessment finder, maybe it's all the way through. We're going to try to get a little less structured and a little more sort of, you know, integrated with all of our products and the whole experience.
This is a great question from Navadi. You know, how can we help? How can we contribute? I just reiterating what you were saying earlier.
Yeah, like I said, like if you see anything, let us know. I mean, I'm easy to find on Twitter, and our feedback box is always there. That's a huge help for us. And take a look at the open data set and the code we've got up on GitHub, and you know, we're always open to feedback there.
Okay. Any, I feel like I'm not seeing any, if I'm missing any questions. Are there any other questions? Does anybody want to verbally ask a question or just drop a Q in?
There was a really interesting question around the protests that are going on currently, and if there will be a recommendation for someone that has attended the protests to go and get that.
Sorry, what's the question?
There was a question around the protests that are going on and whether or not someone that has been attending the protests will be asked to go and get tested, which is, I feel, really interesting in the context of everything that's been happening.
Good question.
Good question. So that's Bane, who's our tech lead, who's managed to make absolute magic happen with React, and we've had some very late nights together. So he's sort of like the technical master behind this. That's a great question, right? You know, it's something I can go back to the chief medical officer area and say, are we going to be asking questions about, you know, not just are you spending a lot of time maybe on public transit, you know, and have you been attending, you know, protests or Trinity Bellwoods, things like that are very real. And, you know, it's a good point because you have to look at where the sort of the risks are. So when we designed the assessment center list, we were kind of like, okay, look at where all the COVID cases are. Maybe we should put the GTA first and foremost. Apologies to Ottawa, but by making it super easy to quickly drop down and see Toronto, Peel, Durham, Halton, and then our Google Analytics validated it like the next day. All the events are there, and then further down is like, you know, Hamilton, Ottawa, and then all of, you know, the rest of Ontario. So that was a design decision that we made, and no one really challenged us on at the time. They just said, okay, yeah, we'll go with that. But that's looking at the data that you have and trying to meet your users where they are and putting their needs based on the data you have available to them as part of your MVP. And that's a decision that was validated very quickly for us. We've also noticed that those people who are using very old versions of Microsoft Edge that doesn't work great with the site are very vocal. I don't know if anyone uses Edge 18, but we're sorry. We're going to get that fixed.
It's great. Any final? We'll post the GitHub link for sure. Any other final questions, thoughts? Thank you so much for sticking around this long. And
I see someone in my dog Beatrice is asking Bane. My dog's asked Bane if we can get the assessment center's code up on GitHub once we get all the search out, because people will probably want to see that too. He said yes.
Amazing.
Actually, Bane deserves a huge shout out because he's right when, everyone else's day is done, he's slogging away and throwing the stuff up on Git and, playing with search and having to manage a release. So this stuff doesn't happen when you work regular work hours right now, and you can't, people like Bane and I, we can't, we have young kids, but we can't go away for whole weekends and not pay attention to this, just because it's hard, right? And it's a challenge, though, as I said earlier, to everyone who's doing this type of work, and is that you need to build in some time to get away. So we're trying to figure out what backups look like and meaningful vacation looks like, and we'll let you know if that happens.
Totally. Self-care for sure, and wellness. Yeah, no, just really positive feedback. Honestly, thank you so much for joining us tonight. Bane, do you want to say something quickly to end off from your perspective? Just any final passing thoughts to the civic tech community? It's so nice to have you here.
Nothing really that Spencer hasn't covered already. Spencer did a great job of sort of.
Well, I will say something that Bane told me, which I really resonated with me. When we were after a week of crushing silly hours, I said, our deputy Harley, the chief digital data officer, said, can we get this back? Can we get this on GitHub? And that's just one more thing when you've been doing everything all week. And Bane said, well, what? We use open source tools, right? The whole site, I should have mentioned, the whole tool is built with open source. It's top to bottom. Bane's like, I use open source software every day. The community is a big part of why I'm here, and I definitely want to give back. And I'm going to make the time for them because they've made the time to give me the tools to let me do my job. So he was motivated not because the deputy said so, at least not entirely, or not because I was asking for it, but because he, gives a shit about the open source software community and the open data community. So, people here, behind the curtains, really, we do care about that.
Yep. Well, that's great. Well, one more time, thank you so much for joining us tonight, folks. Thank you for your questions. And yeah, we'll share the link once it becomes available, but thank you so much. It's awesome.
Okay. Thank you for having me. Thanks for having us. And thanks to Bane for sticking around, and David for being here too. And thanks to Skyder for helping organize this, and Sarah and the whole Civic Tech family. Really appreciate it.
That's great. Okay, I'm officially